Hypertension, also known as high blood pressure, is a chronic medical condition where the blood pressure in the arteries is persistently elevated. 75 million people have hypertension in the United States. Uncontrolled high blood pressure can do serious damage in the body, commonly without symptoms. We spoke to nephrologist Dr. Bryan Stone, who discusses the new guidelines for hypertension.
The new blood pressure numbers have recently come out, and this is going to be an incredible challenge to our system, to both the patients and the physicians, and we're gearing up to handle it. The question of hypertension initially is a very important question, but also one that's misdirected in some regard. The truth is, we don't care at all about hypertension, okay? And the reason I say that is what we're really interested in is what is called an end organ damage. That means we're interested in the stroke that comes from the high blood pressure, the heart attack, the loss of kidney function, the eyesight problems. The blood pressure measurement and control is to protect those things, but remember that it's a middle ground. It's what we call a surrogate. In other words, we know that people with higher pressure sustain more damage to those areas. So our goal is to bring it down. But what it implies, and what's very important, this is what we're trying to teach the new doctors, is it's not just about bringing those numbers down, but picking medications that bring them down and protect against the heart attack, because that is the real goal of what we're doing. Now, what's happened recently, they came out with the new guidelines, and they keep moving the numbers of where our targets are, but what they did recently is brought them down. And our new goal is that we should try to get everybody below 130/70. Now remember, this is going to move again in the future because this gets revisited about every year to every other year. But let's look at the implications of what just came out. So this means now that from one day where we were using the old guidelines to the new day where we're using the new ones, we now have millions of people, additional people, that now have what we call hypertension. That means they're in that area that they're now out of our goal, our target set. And all of those people now need to be seen, need to have their lifestyle adjusted, need to have medications put in that bring down those numbers. And it also means going forward, we're going to have to look at what happens when we bring those numbers down. Are we really seeing that we're getting fewer strokes, fewer heart attacks, fewer loss of kidney function, fewer people going on dialysis? Because those are the hard endpoints. That's what's important. But with that, we're going to see a higher cost. We're going to see more people on medications. We're going to see more side effects. So everything is about to change dramatically with those numbers.
Controlling blood pressure is often a partnership between doctor and patient.
Now, for a patient coming into that, the best thing for them to do is say, number one, I'm concerned about this and I want my blood pressure treated. And number two, I'm willing to work with you, physician, on whatever you're telling me and listen and make some of those lifestyle modifications. Maybe adjust your diet, a little bit of exercise, watch the salt that you're taking in. And then three is we need the patients, the people themselves, to come in and participate. That means that they should at home have a blood pressure machine where they're monitoring their own numbers and come in, because if you bring in those numbers and I'm not just seeing the blood pressure my medical assistant took at that moment, I can make a much more informed choice about what I'm doing for you and probably impact down the road better on heart, kidney, and brain. The blood pressure cuffs that are purchased at home that reach, your upper arm are actually quite accurate. And if you write down the time that you took it and what the numbers are and the heart rate, your physician has 100 times more information to help you.
Dr. Stone gives his best advice to patients with hypertension.
The best advice right now to a patient who hears about the new guidelines and wants to be treated is what we just said. Basically, tell them you have an interest, that you care about your own health, that you're willing to make changes, and that you're willing to help the physician monitor those things at home and adjust your medication. And then if you do those things, you're going to have a better outcome, you're going to have less cost to your care, fewer office visits. It's a win-win for everybody involved.